Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Over the last 24 hours, we have identified 877 new cases of COVID-19 and completed nearly 8,100 tests. I'm pleased to see our new case numbers declining. This suggests that our public health measures are beginning to have an impact, thanks to the sacrifices Albertans are making every day. However, there is still more to do, and we have a long way to go. Our positivity rate currently stands at about 11.4%, and despite lower daily case numbers, has remained at this high level for weeks. This remains concerning. It's easy to forget that at this time last year, our positivity rate was about 1.5%, and this difference emphasizes why public health measures are still needed right now. Our hospitalizations remain high, with 691 people in hospital being treated for COVID-19, including 187 in the ICU. Sadly, I must announce that 4 new deaths were reported to Alberta Health in the last 24 hours. These individuals were loved, and I know they will be sorely missed by their family and friends, neighbours, and communities. My sympathies go out to those who are mourning someone they cared about, no matter the cause. We have now administered more than 2.24 million doses of COVID-19 vaccine. As more and more people get their shot, I know that many are wondering when exactly they will be able to get their second dose. As I said last week, right now second doses can be booked 3 to 4 weeks after the first for Albertans who are profoundly immunocompromised by calling 811. All other Albertans will have an opportunity to get their second dose about 3 to 4 months after their first dose. I know that this wait can be frustrating, but first doses provide good protection, and delaying the second doses is allowing us to vaccinate the province as quickly as possible, which helps protect all of us by further reducing the spread. Everyone who wants a vaccine will get one. No one will be missed. With more vaccines arriving every week, we are looking at when we can start offering the second doses. We don't have an exact timeline yet for when this will occur, but we will update you when more information is available. I'm happy to say that more than half of Albertans over the age of 12 have now gotten at least 1 dose. This is a significant feat and something that we should all be proud of. It is further proof that we are getting closer to the end and that things are getting better. The evidence on these vaccines is clear. They are effective and safe. They help prevent transmission and strongly protect against severe outcomes. However, our rates are still high, and more than 2 million people still haven't had their chance to receive a vaccine. That is why we need to keep increasing immunization rates in all age groups, 12 and over. This is the key to controlling the spread of this virus and safely being able to ease the rules in place. Until then, it's important that all of us continue following all of the public health measures. While it may be tempting to go visit grandchildren and give them a hug, or get together inside for a friend's birthday, these activities are still not allowed. This will not be the case forever. But right now, this will be the way we can protect each other and prevent spread while we are working to get vaccines to those we haven't yet reached. I know many people are anxious and eager to get back to normal. We all are. Let's use that as a motivation over the next few weeks. Motivation for us to book a vaccine appointment if we have been waiting to do so. And motivation to follow the public health measures today so we can end the third wave and prevent more people from getting sick with this virus. This will help all of us get where we want to be, a time when we can safely return to doing the things that we love and spending time with those who matter most. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
First is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. The Education Minister is intent on kids going back to school next Tuesday. Is that based on your advice?
The decision to have children move to online learning was an operational decision and one that the Ministry of Education again could comment on in more detail, but was due to high community transmission putting pressure on schools, with exposures causing many people needing to quarantine and difficulties finding sufficient staff, substitute teachers to be able to continue to operate schools. We see numbers beginning to decline. We see the beginning of what, again, we believe to be an easing of that community transmission, while we still have a ways to go. As community transmission reduces, pressures on schools will also reduce. And it's important to remember that with the measures in place, while there were some transmission events within schools, schools have never been a predominant driver of transmission within the community.
Kevin, is there a follow-up question?
Yeah, I'm just looking for a yes or no answer. Is that specifically based on your advice for kids to go back to in-person schooling on Tuesday?
I just want to be clear that the decision to close or the decision to move to online learning was not based on a public health need. And so the decision to bring children back, again, it was a decision based on educational considerations. I don't believe there to be a public health risk in bringing children back to school. But again, the shifting has been based not on a public health driver, but rather, again, on that operational consideration.
Operator, could you put through the next caller, please?
Next is Jeff Slack with 660 News. Go ahead, Jeff.
Hi there. This is sort of a follow-up question to Kevin's. Hinshaw, you've talked before that you are a parent, and would you feel safe about your kids returning to school come next week?
Absolutely, yes.
Jeff, is there a follow-up question?
Yeah, it's just on a different topic. Yesterday, the Premier hinted that we could see things start opening in the summer if cases decline and more people get vaccinated. We've done this before where we see a reduction in cases, we open things back up, the numbers start to rise again. I understand more than 50% of Albertans over the age of 12 have been vaccinated with one dose, but is there still a risk if we open things up too quickly that cases will rise again?
We're looking at jurisdictions around the world as we make recommendations about the kind of opening framework that would be recommended to minimize this risk of opening causing a surge in cases and a subsequent surge in hospitalizations and potentially deaths. And so again, there's always the potential, if opening happens too quickly, before there's sufficient protection and there's high transmission still going on, that it could cause a surge. But as long as we are able to continue to have our numbers dropping and immunization rates rising, we will reach a point where those two numbers will be able to be protective of the community. And again, those are the types of conversations that will be happening over the next week as decisions are made about what that final framework looks like.
Operator, could you put through the next caller, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. Just going back to schools, in your opinion, are the metrics, so positivity rate, case counts, R value, vaccination rate for students and teachers, are they all at a point where it is safe and reasonable for children to be going back to in-person learning?
I want to go back to what we saw in January, which was a time where we continued to have relatively high transmission in the community. Our new case numbers were still relatively high, and we moved children back into in-person learning as the very first thing that was done after the measures that were put in place in December. And with that shift back to in-person learning, while keeping other activities restricted to limit transmission, we saw absolutely no inflection in case counts. And so again, I just want to be clear that with all the restrictions in place and with public health measures in place to limit potential of transmission in schools, we have already seen this back to school transition work very well, even in a time of relatively high transmission rates. And that was prior to the opportunity to have many of the older students and teachers and staff receive vaccine for protection. So at this point in time, again, I think that with community transmission beginning to see a decline, with immunizations on the rise and with other restrictions in place to limit transmission of COVID-19, schools have been, in this last year, one of the safest places for children to be.
Julia, is there a follow-up question?
Yes, thank you. At what point would in-person learning be prioritized over the reopening of other sectors in Alberta's reopening plan? And also the province has acknowledged that there can be aerosol transmission, so what changes should be made to make schools safer? So for example, smaller class sizes, upgraded ventilation, taking classes outdoors, etc.?
So what we've seen, again, over the past year with respect to the measures that are in place in schools with required masking, with cohorting, with regular symptom screening, and all of the measures that are in place to minimize transmission in schools, we have seen that schools have not been a location of predominant spread. We're adding to all of those protective measures, a layer of protection that vaccine can bring. And again, older students as well as teachers and staff have had the opportunity now for a week or more to be able to access that vaccine, and those protection numbers will continue to increase. While it is possible in some very specific contexts for aerosol transmission to contribute to transmission, again, it's really important that we continue to look to the real-world evidence and the fact that we have not seen schools contribute as a significant driver of community spread. And there's no reason to believe that at this point in time we would see a different experience than what we've previously seen.
Operator, could you put through the next caller, please?
This is Dylan Short, Stevenson Journal. Go ahead, Dylan.
Hi, Dr. Hinshaw. You spoke a bit there about second doses and the timing around second doses. I want to ask you specifically about AstraZeneca. We know that there's no longer first dose appointments available, but there still are thousands of Albertans that have had their first dose of AstraZeneca, and they're now wondering about their second doses, whether it will be one of the mRNAs or if it will be AstraZeneca when shipments continue to come back in. I guess, what update have you had since that announcement that there would be no second doses scheduled? No first doses scheduled that came out last week. I guess, where are we at in looking at the research and making any determinations?
The UK has been working on a trial to look at the impact of offering an AstraZeneca first dose and a Pfizer second dose, and vice versa. The results of the impact on local reactions after a second dose was released last week that showed there were no safety signals when a first dose of one vaccine followed by a second dose of a different type of vaccine were provided. There was an increase in local reactions, so an increase in the percentage of people who experienced a fever or muscle aches, those kinds of general symptoms that went away after a few days. So that was seen more often in people who received a different type of vaccine for their second dose than they had gotten for the first dose. What we don't have yet is the data on the results of the antibody levels and how the second dose with a different type of vaccine impacts that particular marker of immune response. So we are waiting for that data. We expect it to be available within the coming weeks. And we have been having regular conversations across the country with my colleagues as we are all looking to make decisions about our own vaccination programs in the provinces and territories, and wanting to make the best possible decisions with currently available evidence. And again, that is expected to come within the coming weeks so that we can provide that information to Albertans about the types of vaccine that will be available for those who received AstraZeneca as a first dose, what they will be able to receive as their second dose. But I want to reassure Albertans who received AstraZeneca as a first dose that they will have a second dose. And again, the question right now is just how we make that available to them using the best evidence based on the anticipated results from these trials.
Dylan, is there a follow-up question?
Yeah, just going back to schools, I know it sounds like the topic of the day, but I guess, you said it was more about operational to close them down. So I guess as we move towards Tuesday, what exact metrics are being looked at to make sure that they are okay to safe? Is that, the number of teachers that have gotten a first dose, or the number of teachers that are no longer have to self-isolate, or what specifically will be looked at moving towards Tuesday?
The operational metrics would be best described by the Education Ministry, so that's something we can work with them to get an answer in terms of what they're looking at. With respect to public health, again, it's important to remember that the school context is one that we've seen impacted by high community transmission, but not a driver of transmission, and this was very clearly illustrated back in January. So we are seeing that our new daily numbers are beginning to drop. We are seeing some, again, indication that the public health measures may be having an effect. And so as long as we continue to see that decline over the next week, where community transmission is reducing based on, again, all of the combined efforts of Albertans to prevent transmission, to prevent in-person gatherings, then that will be the most important public health metric with respect to having schools go back in person. Again, because we've seen that community transmission level is an important marker of when exposures are more or less likely to happen in schools.
As Dr. Hinshaw noted, Alberta Education can certainly provide additional operational specifics if needed. Operator, could you put through the next caller, please?
Next is Aaron Collins with CBC. Go ahead, Aaron.
Thanks. Just a bit of clarity there. When we're talking about returning to in-classroom instruction, would that be K-12, or is the sense that you would go back to K-7 first and potentially then open it up to junior high and high schools?
Because the decision to move to online learning for all grades was, again, a decision that really was made through the recommendations of the Education Ministry. The questions about the specifics of which grades might be contemplated, again, from my perspective, the most important metric is community transmission, which would hold true for all different grades. But specifics about what's being contemplated in terms of proposals, again, those are questions best answered by the Education Ministry. They would be able to provide more information on that.
Aaron, is there a follow-up?
Yeah, I appreciate that, and of course we have reached out to the Education Minister. I'm curious, has the Education Minister asked you what you think?
Our teams at a department level work closely together, so the teams in our Emergency Operations Centre and the public health side do work with the teams in education as different options are being pursued. But again, from the public health side, we really are focused on the importance of lowering overall community transmission as the way to keep schools safe, and also the fact that providing students the opportunity to learn in person is an important support to their overall well-being, and considering that whole health concept, it's important to remember that students' health and children's health is much broader than just whether or not the again, that kind of COVID-19 consideration is one consideration of many. And so from a public health perspective, those are the two kinds of things that we would be offering opinions on. But again, the final operational decisions would be down to education.
Operator, could you put through our next caller, please?
Next is Jesse Weisner with Global TV. Go ahead, Jesse.
Hi, thanks for taking my question. Now that case numbers are starting to decline, will the province once again start screening all positive samples for variants of concern?
We've been having conversations with the lab about the representative sampling that's currently being done and looking at the relative proportions and whether or not the screening that's currently being done is catching a representative sample of Albertans so that we have a good understanding of what's going on. I want to be clear that every single positive case that requires acute care, so all those who are admitted to hospital, every single case that is linked to someone who has previously had a vaccine and then subsequently developed COVID-19, every case related to somebody who's come in from international travel, all cases in outbreaks, all of those plus a geographically representative sample are being screened for variants of concern. And so right now we're looking at that data to determine whether or not the current representative screening gives us essentially the same proportionate information that screening all samples would give, because it's really important that as we plan forward and look forward, we are making plans to create systems that will be sustainable in the long run and making sure that we can use our lab system as effectively and efficiently as possible. So a final decision has not yet been made, because again, it will really depend on if our current process, which is comparable to all other provinces, is providing us with all the information we need. We may not need to go back to screening all positive samples.
Jessie, is there a follow-up question?
Yes, thank you. Also, I'm wondering what's happening with testing numbers. What could be behind the lower numbers that we've been seeing?
It's a good question, and one that I have been talking to my colleagues about. We know that there always have been some fluctuations over the course of a week, so weekend numbers are always lower than weekday numbers, and that's something that's been consistent over the course of the last year. We know that things like having people staying at home for the most part may impact their decisions about whether or not they feel that going for a test is important. If they're able to stay home and isolate, even if they feel a little sick, they may feel that going out for testing isn't necessary. I think there's also potentially impacts again on sometimes we see weather patterns impacting the number of people who go for tests. The bottom line is that I want to emphasize all the metrics that we're looking at help us to understand the course of the pandemic, which includes that positivity, the new case rate, as well as the R value. And so we are able to track all three. And I would encourage people, if they are feeling slightly ill, if they've been a close contact of someone who's a case, that it's important to seek testing so that we are able to get that full picture. However, again, we are able to kind of watch that over time and use all three of those metrics to understand the trajectory and the trends.
Operator, could you put through the second last caller, please?
This is Lauren Pullen with Global Calgary. Go ahead, Lauren.
Hi there. Thanks for taking my question, Dr. Hinshaw. Just hoping for a bit more clarity around the school's potential decision to be reopening on Tuesday. If that is in fact the case, what does that mean for kids' sports that were sidelined as well? I know that we have multiple layers of restrictions in place, but if schools go back on, does that mean that those kids' activities will be back on as well?
It's important, again, to remember and learn from the experiences that we've had over the past year. And when we, in November and December, put in place restrictions for kids' sports, kids' recreation, and then, as you'll likely recall, a couple of weeks before the Christmas break, the junior and senior high students moved to online learning while the elementary students stayed in class in person. And interestingly, we saw when we stopped the children's sports and recreation, as well as the other restrictions that were in place at that time, the case decline in both junior, senior high, as well as elementary schools was an almost identical pattern. So we are prioritizing, again, if there is to be a return to in-school learning for operational reasons, that would be a decision that would be made independent of the need to have public health measures in place to continue dropping our overall case count so that we can ensure that we get to a low enough transmission level combined with vaccine protection to be able to consider reopening. So those two decisions will be made independently.
Is there a follow-up question?
Yes, thank you. On a bit of a different topic, we got those vaccination by neighborhood stats that made public yesterday, and we're able to dive into them a bit. And it appears that the areas with the 3 highest case rates have the lowest vaccination rates. Is the province going to be pushing for those pop-up clinics anytime soon, or what kind of messaging or changes can happen in those areas that are seeing the incredibly high rates but not seeing that same uptick in vaccination?
We are looking at a province-wide approach to making sure that those areas with high cases and low immunization coverage, that we're looking at what the barriers are and then looking at ways to most effectively address those barriers. And so again, that's something that we have been looking at and wanting to make sure that both the questions about physical barriers such as logistics and hours of clinics, those kinds of things, as well as information provision, trusted providers, partnering with local community leaders. We have been working for many months with local community leaders in many areas to support information provision, and now we're just having the discussions about the potential next steps for the areas in the province, again, that have those 2 metrics of concern with high rates and low uptake, to see what our options are with respect to focused provision of services in a way that's most effective for those areas.
Operator, could you put through our final caller, please?
Final question is Emily Mertz with Global News. Go ahead, Emily.
Hi, thank you. I'm just wondering if you can explain the science behind why it's important for a significant percentage of the population to get vaccinated. What happens in terms of the virus transmission and the variant evolution if we don't reach, for instance, 75%?
What we know is that when someone receives a vaccine, not only are they protected because that vaccine, again, provides them with the immunity to in most cases, prevent that infection and severe outcomes. But even after somebody's been vaccinated, in the small number of cases where someone who's vaccinated goes on to get sick, there's good research coming out of the UK now showing that even after the first dose, if someone ends up becoming infected, they have a lower risk of going on to have severe outcomes, and they also have a lower risk of passing the virus on to others. And so that's really what we're looking at when we're targeting that high level of population coverage, is to prevent the virus from spreading widely in the community. And if you think of it, I've talked before about trying to build a wall of protection against sort of a flood of the virus. And if you think right now about the fact that we still have very high transmission rates, still have very high positivity, and if you think of the public health measures as the current wall to prevent the virus from flooding into our communities, as we build up that vaccine protection, it needs to be at a high enough level to get to a point where the public health measures can be taken away, and that vaccine protection will provide the defense against that flood coming in and spreading widely and overwhelming the acute care system, and again, trying to use the vaccination coverage to protect people not only from the illness, but most importantly from those severe outcomes that happen.
Is there a follow-up question?
Thanks. I'm just wondering if you can give us an update on the plan or the discussions around school immunization.
Sure. We know that in-school immunization is an important part of our immunization program for routine childhood immunizations, but it also takes quite a bit of time to roll out those immunization programs across the province in the specific grades where they are offered. We are looking at the possibility of school sites when it comes to areas that have high rates and low coverage as a potential adjunct, but no decisions have been made yet. It's important, again, to know that with only several weeks left yet in the school year, it's unlikely that we would be able to roll out immunization in every single school across the entire province this year. However, we will be looking at whether or not, again, that particular setting may be a part of how we offer vaccine to those areas where there are barriers to uptake, and if that's a part of how we make vaccine more accessible to those who want to take it.
Thank you all for joining us. Dr. Hinshaw will provide another live update later on this week. Have a safe evening.